So normally we just go straight into the podcast recordings on YouTube, but for reasons that will become clear and obvious, and particularly if you don't know of Eva, I'm going to introduce Eva, and I'm going to do that in two parts. So first the biography and the background, and then partway through the interview I'll step out of the discussion and give you some facts and some details relevant to a specific incident that I think it's fair to say drew a great deal of attention. So Eva is a sports physician and was one of the first pioneering doctors recruited nationally to the UK Sports and Exercise Medicine Specialist Training Programme. And she worked out of the New South Wales Institute of Sport in Sydney and at the Olympic Medical Institute in London, and specifically in the lead up to the Beijing Olympics in 2008. And Eva also worked at Chelsea Football Club from 2009 to 2015, and during her 4 seasons as first team doctor, that team was successful in winning the Champions League, the Premier League, the Europa League, the FA Cup and the League Cup titles. And during the 6.5 years working with the team, she worked with a total of 7 elite international football managers. She was the first woman to sit on a team bench pitch side in the Champions League, Premier League and Europa League competitions, and the first female medical director in a football club in the UK. So that's the introduction to Eva's medical and performance credentials. And as I said, what I'll do is give you the plain facts partway through the interview. But in short, for now, Eva filed for constructive dismissal from Chelsea Football Club. And at that tribunal, the case was settled with a full acknowledgement that effectively Eva was just doing her job, and I quote, was following the rules of the game. Now, Eva's case received widespread media and public attention of all sorts. Accusations of pressures, intrusions into her personal and private life for, as I say, essentially doing a job. Now, if you've tuned in to hear all about the dirty details that went on behind the case, then you're in the wrong place. That's not what this recording was about. However, if you want to hear from someone who has operated at the heart of one of the most successful football clubs in recent history, if you want to hear the piercing lessons from someone who has lived through unwarranted scrutiny and exposure, but has upheld the utmost professional approach throughout and is leading a campaign for higher standards of professionalism, ethics and governance, and ultimately standing up for what is right, then you're in the right place. The fact that she has also pioneered in a male-dominated environment makes her achievements and perspectives and her voice perhaps even more profound. Eva, welcome to the podcast.
Thank you very much for inviting me to speak today, Steve. It's a pleasure to be here.
Now, Eva, as the first female team doctor on the Champions League bench, can you tell me how excited you were to sit on the bench for a Premier League team in the Champions League? What was it like for you?
Well, there was very much, obviously, we were under the pressure of what you need to deliver. So there's high stakes in football, and it's an extremely pressured environment, and suddenly that pressure is palpable in the dressing room before you go out to play large teams in the Champions League. And I think we all felt that. So what you do is you concentrate on your job, and you're sort of trying very hard to deliver what each individual, each member of that team needs from you. And often that timing is crucial as to treatments and what you're going to do to install confidence. That is also a very the mental aspect of performance is really important, I think. And then when that is over, I think is when I had the opportunity to just sit back when you've done all your jobs and the boys are ready, as for example in the tunnel, when you should take a breather and go, okay, wow, I'm actually really here. And I think for a little 16-year-old girl from Gibraltar who suddenly decided that she really wanted to be a football doctor, when there was no defined training pathway in the UK, to then suddenly have that realization a few years later, fair to say, that you're actually there, that you're living your 16-year-old dream. It was an amazing moment.
So was it your dream? Was it, as you were thinking, I want to study medicine, but I want to study medicine in that environment?
Absolutely. My difficulty was that there was no established training, but actually I remember I wanted to be a vet until I was 16. And then at 16, I decided I really didn't want to put down any of my patients ever or use them for practice. And fascination for science and movement, was really sporty kid, loved dancing and horse riding, very polar opposite sports for a developing skeleton, and really didn't have any sort of serious sort of specialty type advice as to how to condition myself to be able to perform in those two sports as I was growing. And my skeleton was changing into sort of an adolescent girl. So that basically brought up a few injuries, and that sparked reading. I remember very clearly sitting on the beach after my GCSEs, and we'd gone to the States on holiday, and I bought this American College of Sports Medicine book. And I remember sitting on the beach and actually reading it cover to cover. And my friends were like, there's a particular word in Gibraltarian slang. And it was like, that they use very, so like, what is wrong with you? This is our holiday. But I was just like, I've got all the answers here. You don't understand. This is what I want to do. I remember the beach and the place and my position on the towel and my little bikini then. And so, yes, and then because we had this culture of loving the sport, it was a natural follow. It was just more, it's what I wanted to do. Interestingly, I didn't really see any obstacles as far as gender, because I didn't really see my gender. I was a complete tomboy, mainly played with boys, because they were active, and my little social circle in Gibraltar, sort of the boys I knew were more active than the girls I knew. So that became what I wanted to do. It became my goal.
Wow, that sounds like a real calling. I could only ever see a PE teacher when I was 15, 16 years old, but you had this you were really projecting into the elite sphere at that stage. That's an amazing fact that you felt that purpose.
And I think it's to do with I guess I loved my GP. He's an amazing man who I wish had survived long enough to see where I got to. But he was a GP with a special interest in sports medicine, an avid hockey player, Dr. Valerino from Gibraltar, and but his experience of real sports medicine in terms of what load management and progression and prehab and rehabilitation for certain conditions was limited. So the answers I used to get were rest, like every time that my knee problems came back, rest. But the rest period got longer, and the same pain returned on competition, when I resumed competition, and really demoralizing as it is for anybody who loves to move, loves physical activity, loves sport, to stop, especially when at 16, when you're not armored with patience. So I guess that is what really, what I observed on the field, I guess, is a perception of the expertise that it took to rehabilitate these players to that level. And I was very aware that wasn't around me at the time. So it required specialist training. So I wanted to be good. I wanted to be able to advise those that were struggling with injury to be able to sort of do more than rest. And that's what really sparked the interest in this book and then the interest in and a passion for this career.
Fantastic. Love that. So fast forward then to those highlight moments. Can you share with me a few examples of where you've had to pinch yourself of thinking, right, I was a 16-year-old girl reading ACSM books on the beach. Which just saying it sounds wrong. But how was it when you're in the tunnel or in the dressing room, are those peak moments against top opponents?
So, I mean, there were those, like I say, once work was out of the way and I was able to, still high on adrenaline, but be able to breathe and take in the atmosphere. And the atmosphere at Champions League games is really palpable. It really infiltrates every molecule in the buildings that we play those games. So I remember particularly playing Barcelona in the semi-final on the build-up to our Champions League success. And there's a moment where I remember I was a kid that had watched some of these players go up through the ranks, and players like Fernando Torres and was it Didier Drogba and Messi was still very prominent. And I remember a moment when I'm behind Fernando Torres, he's chatting, Didier is sort of in front of us, discussing with the opposition, possibly trying to mentally intimidate them. And then there's so I'm like literally looking forward and going, I'm literally living my 16-year-old dream here. And I remember I took a little bit of an illegal photo with my phone because I'm like, it's not a particularly pretty photo. You see, it's like, the players that I'm talking about and the tunnel. I can't know, but I'm literally going, I just want to remember this forever, and in my difficult moments around, I'm going to look at this photo and go, yeah, you were that little girl in Gibraltar on the beach and this is where you are now. And I think the cherry on the cake was, what was really important to me in that was actually, I was just part of the team. I wasn't only there, but it was normal for me to be there. It was a non-issue. My gender was a non-issue. I was literally another person in that team that was working very closely with this amazing world-class athletes and another piece of the puzzle. And that meant a lot to me. And I think there's a moment when I remember sort of Messi was up ahead on my left, and he looks round and looks at me. And then there's just a little nod and a smile of acknowledgement. And it was incredible. It was just like a moment of, yeah, I'm part of this. I'm now part of this world, and it's a non-issue, which was almost cherry topping on my cake, really, to that moment. I think there's another moment in the dressing room as well, actually also to do with that game. There were other moments, but that game particularly, I guess, with the Spanish father as well, Barcelona was important and they had such amazing players. Although I should state before he kills me, my father is a Real Madrid supporter, but not a hater of Barcelona. So and I remember sort of in that dressing room, basically at half time, we were a man down. John Terry had just been removed from the field, and we were a man down against unbeaten Barcelona Football Club, who were giants. So we were definitely thought that we were the underdog and felt so. And in dealing with each of those players and the treatments that you deliver at half time and both the surveillance, how is this going? How are you feeling? Does anything need doing? That's very much what happens at half time. You're making sure people are well hydrated. You're making sure that mentally they're in the right place, dealing with whatever little niggles or discomforts they are, whether anything needs topping up, whether there's any sort of masking agents that you do need. And in those conversations, I think I remember sharing with you, I'm not necessarily an optimist. I'm a realist. I'm a sort of realist that can be optimistic. And in that moment at halftime, talking to these players, I remember saying to them, we're about to win this. And there's nothing on us that can stop us right now. Because I just felt these boys were working as a team, so together. All of us were in this moment. And I just knew that we were invincible in that moment. And I think, I remember thinking, it still brings goosebumps to think of the atmosphere in that dressing room. And I remember thinking then, I'm never going to live through moments like this again. These will be moments to tell my grandchildren. And we did. We beat Barcelona.
Wow. I love the phrasing there. I love that. You started saying the atmosphere infiltrating every molecule of the buildings. God, I hadn't thought about concrete getting excited, but
you really did feel it. It was almost this vibration that came off where everybody was in this moment, and it was amazing. And a fantastic, of course, pressured but very optimistic energy, and the professionalism of those players. The dedication, the being in that moment, concentrating on the performance that they had to deliver. There's us as supportive staff. Catering to what was required to produce this performance. They are the I guess the epitome of what I imagined to be elite sports medicine in football when I was a 16-year-old girl.
I mean, it sounds like a real flashbulb moment of just the memories that the experiences have given you. But it sounded as though you were playing an active role, you were additive, you were reinforcing that team spirit and team dynamic as a team member. It's not just attending to any niggles or issues and injuries, and that's a transactional relationship, that you're sensing a team dynamic, you're feeling that, you're weighing up the odds based on being a man down, an important leader figure down, against the most or the strongest team on earth at the time, and then geeing them up and adding to that spirit by saying, we're going to do this.
Yes, I mean, I mean, I think I read your book, Supporting Champions, and there were so many parallels about what you were describing. And I think it when you're working with these giants of men, because that team was incredible. We had such amazing diversity of world-class players from different parts of the sphere, really. And it's just knowing how to, you're going on this journey with these athletes to gain the trust of these athletes. You have to go on the journey with them. And that sometimes means assuming risk with them, and owning it. But being obviously very honest about what those risks are as far as your clinical expertise can deliver. But I think that, you are on this journey and you are living it with them. So I don't think there is a way of being part of this circle without actually being part of this. And because we have the fortune that we get to know our athletes really well, you then know when to give them confidence to push forward, because they are human. They are vulnerable to moments and situations and even personal moments or fears created by injuries. You then need to know when to give them the confidence or when perhaps to pull back from that, or saying, actually, no, this is a risk we should not assume. And I think if you say yes, if you're on this journey often enough, saying yes and owning the risk, even to yourself, because you're making decisions about what's best for the athlete and best for the team, not necessarily what's most comfortable to yourself, as long as you're not obviously putting, there are no risks that are unassumable. I think there are boundaries that we shouldn't cross, and those are clearly defined. I was always very honest to my players about those. But I think it is, like you say, it is, you have to be part of these circles. You have to be on that journey with them and be part of that integral part that knows when to give, when to take, when to support, when to remain silent and in the background and celebrate their success.
So I'd like to ask you a little bit more, maybe in a bit about risk and handling those decisions, and you've obviously made some important decisions over the years, but just linking back to the current day about football restarting across Europe a few weeks ago, in the UK just now recently. And so we've had a phase of players being able to train together and then competitive matches restarting without crowds. If you were back at a club, what would be your thoughts about the risks to players, both in terms of COVID-19 and given the limited amount of time that they've had to prepare before restarting?
Yeah, I mean, I think each club is almost a different world, because the 20 clubs that are in the Premier League, there's a different level of resources, there's a different level of staffing that brings, and sometimes even micro cultures, even though there's a bigger culture in football. So I think that depends very much on the club you're in and how well you think you can deliver what's required. I guess the big surprise, and where I felt the need to voice my concerns when asked, is I guess what surprises me is that we were in phase 1 of delivery of return to sport, and we were already locking in a date for return. And we hadn't gone through to the further stages, really, to say, actually, it works, we can contain it. To deliver, it's fair to say that football doesn't have a culture of respecting medical governance. It's very much left to the doctors to deliver protocols and procedures, but the systems are absolutely not in place to both protect the doctors and really safeguard the athletes in moments where it really matters, in high-pressured moments. I think non-medically qualified staff have a lot of power, and that's where it becomes a real challenge, because I think despite good relationships, good communication, in a moment, in a culture that is so relying on short-term results, pressures can overcome medical decisions. And so I guess my concerns is that you don't learn a culture of medical governance in 3 weeks. It's just impossible. And even if you are, and there are very positive things about this process where there's a huge investment, the testing twice a week, that there's obviously a huge effort. And I want to stress that this is not to take away from the huge collaborative efforts that my colleagues in football and in other sports have engaged in, because it is an immense effort and it deserves a lot of credit. But I think we also have to be honest about the cultures we work in. And in order to deliver something that is sustainable and protects athletes in the long term, because COVID is going to be with us for some time, we're not going to have a vaccine tomorrow. I think we need to be able to be confident that the protocols and procedures and subtly systems that are in place are going to be with us and going to be carried out for the foreseeable future. And my fear is that without this culture, without this reviewing, without this audit whether the stages work, we've gone into full competition, and there's going to be a fatigue of this protocols and procedures because there isn't a culture of respecting them to begin with. There'll be a respect of the new, there'll be a respect of the fear of COVID, but then it'll become normal life. And that's, I guess, where I have expressed concerns, where I think we don't know, if we're honest, this virus hasn't been with us for long enough. I think the athlete is very different from the asymptomatic general population. They exhibit different traits. We speak about immunosuppression in the athletes at the higher intensity. I saw this clinically in football. We're learning about the athletic heart within the COVID environment. And again, amazing effort by cardiologists and Sanjay Sharma and his team in understanding with emerging science, constantly emerging evidence, constantly, so very quickly coming up with protocols and procedures. But I guess we need to know that these protocols and procedures work within the environment that is football culture. And we've jumped into setting the date. And I think once you start that tsunami of effort and excitement about full contact sport, it's very difficult to then put the brakes on it. So that I think that is where, much excited that I am to see football back, and yes, we all need to see it, and we certainly need it for morale. And I still have concerns as to how we've done that. This is an experiment. We're doing this. We're delivering medical governance in an environment that isn't used to it, that doesn't tolerate it terribly well. And we're doing this in the middle of a worldwide pandemic. And we're not waiting for our results of audit before we progress to the next stages. So I think on the positive, we are seeing governance procedures introduced. Apparently, the Premier League is surveying the protocols and procedures are adhered to. There's going to be audit carried out in the future, but I guess that's it. It's just jumping almost the stages. We're the only country in the world that's doing that. Football's the only sport in the world that's doing this. And unfortunately, our handling of this COVID crisis in this country isn't exactly a badge of honor. So yes, it's fair to say that I have concerns about what we're doing.
So you allude there to non-medically qualified staff, and I presume that there's the whole panacea of sponsors, people who are running the sport. It could be the fact that somebody just simply needs to fill a stadium at some point to balance the books of a club. You're speaking there to an unknown risk, aren't you? There's no handle on this risk at the moment, but I suppose the best case scenario is that it continues to progress, and they'll go to maybe stadia half full or whatever the stage is. But the worst is it's going to go back to normal. It's going to go back to not playing.
And I mean, I think the worst is a spike in the community. And although we can talk about numbers and the population of football being too small to affect our R number, I think if a local population is affected and a local hospital is affected, that means that the population and intensive care beds are not available for people who need them. So, and this is where there is a public health concern here, and unfortunately, we're in a climate where a lot of the information has been politicized. We can talk about it's absolutely good for sport to return for morale, but really it is about the penalties that are going to be imposed in the absence of with dealings with TV rights. So we should be honest about what's at stake. And I completely understand that athletes in this environment are paid very well, but that should not be an excuse for them giving up the safeguarding of both their safety, their families, and obviously the wider community. But there are positives. Like I say, there was talk of CQC visiting clubs for the first time in history. This is good governance starting to take form and shape. with SARS, we definitely saw a difference, a mutation in the virus to something more weak. We're not yet there with COVID, but the numbers are reducing, so there are positives. This could work, but I guess where I'm comfortable is that I'm more on the side of the other sports who are taking the time, who are assessing, who are auditing what's deliverable within their particular cultures, because otherwise, the reality is that footballers are the only individuals in this country who are going back to work without social distancing and without protection PPE.
So you're enacting there your optimistic realist. I can hear it coming through.
Yes.
And what would be your suggestions for maximising the safety of players and staff, given the pressures for sport to restart? It's restarted. That decision's been made. But what would be your suggestions?
I think, fantastic minds have been put to this in terms of public health professionals and virologists and obviously sort of chief medical officers and the clinical expertise of local doctors. So I think I don't disagree with any of the protocols of procedures that we've seen or that have been spoken about. Perhaps I have questions around the transparency of the audits and the numbers that come through. I've been part of systems that perhaps sometimes a little bit of flexibility where the truth and the briefing that happens externally, what might take place may not necessarily be what's reported. So those are, I guess, additional concerns about the reality of the culture, a culture that needs to change. But I think this is a great opportunity to change that, to install the importance of governance, because COVID is going to be with us for a while. So hopefully there is a learning and education of the non-medically qualified going, touching on what needs to happen to safeguard our athletes of the future.
And so as a club doctor, how do you balance the risk and the safety, the performance versus the availability? For example, a split decision where a player, perhaps they're hurt sufficiently that you're concerned, but they could play on. And then you could add another layer where there might be a highly influential player, or perhaps they could aggravate an injury. How do you make those decisions? What's going on either on a day-to-day basis? Is there a framework that helps you, or is it based on each case as it goes?
Well, I think off-field and on-field decision-making are very different. Off-field decision-making, you've got time to deliberate. You've got time to involve the multidisciplinary team who all have very valuable input into what this athlete might be experiencing. I always had very close contact with all the members of the team because it was hugely important to feed back what they were feeling when they were treating, conversations, attitude, sometimes mental state, and then figure that into your assessment of the player. So returning to field was always, or returning to play was always a multidisciplinary decision that was carefully considered and with a very honest discussion about risk. And that wouldn't necessarily be my decision going forward. It's everybody's perspective. It wouldn't always necessarily be mine. I just, you give your bit as part of the team and then you come to a consensus. And that consensus is then delivered to the athlete and the manager with a discussion of relative risk as we see it. And of course, the mental aptitude of the player is key here, because he's going to be ready, emotionally ready to assume risk. And personal factors, human factors come into play as to how able you are to assume a certain risk. And then there's a consideration of the games. Is this game important enough? Do we need this player strategically more for the next game? Is it better to rest now and actually buy time and reduce our risk window in the following game? On field, it's very different, really a very different scenario. What happens on field is that you are challenged by a set of circumstances that you have no control over. And that usually takes place in the form of a trauma. Now, I was very keen to train in trauma and in emergency departments before going into this team role. I wanted to be very confident that I wasn't going to be impacted or scared by anything I saw, regardless of what happened. So I was actually very comfortable making those decisions, as comfortable as you can be, obviously, when you're assuming that level of responsibility. But you are then making decisions within, it helps, I think, not to be sprinting onto the field, because that gives the player, unless of course there's a sudden loss of consciousness, head injury, cardiac arrest, God forbid. But it does help to give them time to breathe and work through their pain, because I think, at the beginning there's a high anxiety, high energy, high adrenaline, and you need to decipher what he is on the pain scale. The advantage you have is that you know your players really well. For me personally, it helped to speak different languages, to communicate to them at a moment of high anxiety or high pain in their own language. To me was very valuable. It gave me a wealth of sensitivity to what they were feeling and thinking in a short amount of time. Important to not be overwhelmed and be pushed into making a decision too quickly. And sometimes you have pressure from refs and managers, and sometimes you just need to be able to walk the field and be able to be given time. And then following that, you're then working. You have to deliver that sort of percentage risk as to returning. And again, going back to, there are some conditions that are non-negotiable, your concussions, your possible cardiac arrhythmia, or your impact to certain parts of the body that you're concerned about. But most of the decisions you make are actually about sort of being very good at interpreting risk and what you can get away with, and actually being able to deliver that to your athletes. It's true that different athletes perceive, as we all do as humans, perceive pain and risk and challenge and ability to push through that in different ways. And it's important, again, to know your athlete and be able to deliver what you feel is best practice to them in a way that they understand, are confident, and feel sure to play on if they're going to.
Just unpicking a few of the points you mentioned there. You spent time on trauma wards, accident and emergency, to not only acquire the skill, but also, I suppose, de-escalate it in your own mind, that you've got a bank of experiences of seeing a whole variety of different scenarios. Is that part of official training to be pitch side at a top club, or is that a step that you took yourself in order to equip yourself? And in some ways, I'm hearing almost like you're acclimatizing, you're over intensifying some of the learning, so that perhaps when you get on the pitch, well, you've been there and seen so many different scenarios that you're less likely to be able to see those certainly at the same frequency on a pitch.
Remember, I started training before, with a focus on sports medicine, considering going to Australia before training was established or existed as a defined specialty in this country. So I observed the professionals that were doing it, both in this country and in Australia and in the United States. And I sort of tried to form what I wanted to be, I was reflective of what I wanted to feel and the skills I needed to acquire after lots of conversations with a lot of these professionals. I always say I cut my teeth in Glasgow, in Govan, where Sir Alex Ferguson was born. And I think although accident and emergency is a part of the training now, I think it was important for me personally to be able to do it somewhere where at the time was a trauma centre, where you had helicopters landing, bringing in very damaged individuals. And then I was very fortunate to work with some impressive doctors and nurses in accident and emergency there, who once you'd done your courses, your trauma courses, let you lead. They'd be behind you, but they'd let you lead these clinical multidisciplinary trauma scenarios. For me as a young doctor then, it was really changed my life. I think it's probably one of the most incredible jobs that I've ever had in my life. And I look back very fondly as to the learning curves and what I was taught, and how the very experienced individuals around me worked to make me learn, sometimes on the hard edge of life, but it was valuable. I think that's what I felt was required of me at the time when there was no defined training. I know that you can do things like sort of GP with a special interest and things, and maybe that requires less emergency work. But I always felt that, in a high contact sport, and there's high speeds and the injury severity is high in football, regardless of what people perceive it to be. I just wanted to be ready to come across anything, be it, so, and I think my instincts for me were right, so like I think within I think it was my second game as a first team doctor. Didier was unconscious on his with a facial injury, literally unconscious on his front. So I was quite grateful that I was like, okay, yes, I know how to handle this. It isn't a problem. And you really shut out the public, you shut out the cameras, you shut out those around you. Sometimes you even shut out the ref, who you ask to step away when you're dealing with, you're having to deal with a multidisciplinary team also that you don't commonly work with in terms of your paramedics and your first responders.
And so you mentioned there about kind of your mindset of focus, you're shutting out. It almost feels a little bit like the conversations I've had with performers that have to focus to deliver the moment in a final, for example, to take the gold medal that they remember talking to Catherine Granger about how at the London Olympics, the noise was just so intense that she had to focus so hard on every single stroke. How did you stay present? How did you focus and stay clear of mind? Do you have a mantra or a few guiding principles that held you steady?
No, I think that's where training comes in. That's where repeated experience of trauma and traumatic situations and high pressure situations where actually individuals are about to lose their life. The truth is as a doctor, you've seen death a lot. You've sometimes been present. You've been managing as that death ensues, and it's just a fact of the jobs you do, which is why, I felt very profoundly the stresses of the frontline doctors during this COVID pandemic, because I think it's a thankless job, and the less positive impressions that you acquire during that training stay with you forever. I remember the face of every patient I lost. And it's just a fact of what you do. Sometimes, unfortunately, there's nothing you can do. So I think that is a very good perspective. I think that's a repeated perspective that you have in your mind when you've been trained and you've been exposed to multiple situations where of course you're affected by what you're seeing, but you've seen the worst case scenario and you sure are going to try and prevent it. So that is, I think, a very I guess what's the word? I think it's a very sobering thought when you can, when perhaps, you could be tempted to be distracted by crowds or what's been shouted at you or stage of the game. Or I think honestly, the experience of death, of human suffering, allows me to concentrate on my job every time. And it honestly didn't require much of a mantra. It just came naturally because of years of training.
So I'm now stepping out of the interview and I'll give you some facts and some details about the case that erupted in 2015 on the first day of the Premier League season. So Chelsea were playing Swansea, and during that game Eden Hazard twice called for medical attention following impact to his abdomen. The medical team was summoned onto the pitch by the referee on 2 separate occasions. Eva, along with the club physio, John Fern, came onto the pitch to attend to the player following the rules of the game. But the manager, Jose Mourinho, reacted to the situation because he didn't feel that the injury warranted attention. And the reaction was pivotal to Eva's case, particularly so that Eva was demoted from the first team, and also footage emerged that Jose Mourinho used abusive phrases towards Eva, which he denied being sexist in motivation. The subsequent furore received extensive press coverage, both for the dismissal and the claim for abuse, but also the character assassination, the personal attention, the scrutiny and sensationalism that followed. That Eva was exposed to all of these, and Eva's lawyers filed for constructive dismissal. But before she gave evidence, the tribunal of the case was settled on confidential terms. But importantly, as part of the settlement, Chelsea issued a statement saying that we, and I quote, "We wish to place on record that in running onto the pitch, Dr. Carneiro was following both the rules of the game and fulfilling her responsibilities to the players as a doctor, putting their safety first." Now this is important because the statement indicates the position that Eva upheld. She upheld that position beyond the stage of that game, beyond the fact that Eden Hazard required medical attention. This sort of reaches well beyond that clash with the manager and the football club, and perhaps beyond sport too, because it's not only about her serving her professional duty, it's that duty of care in doing what is right and not capitulating to compromise, that essentially is what Eva was able to stand up for. Let's return to the discussion. So Eva, given that situation, how was it living through that ordeal?
I mean, I think I feel I've earned the right to move on from that now. It's nearly 5 years now, and I want to look at the future and everything that is exciting about that and be able to enjoy that. But what is important about that future is it is understood that doctors in sport, doctors that have a contract and a duty of care in sport, the same as if they have a contract in an emergency department or any other establishment. If you're contracted to look after players, if you're contracted to look after players that are your patients, in essence, if they call for your assistance, make it clear they require a medical examination, my hands are tied. Those doctors' hands are tied. They have to take a history and possibly examine in order to be able to say there is nothing wrong, play on, or discharge in an emergency department. Doctors do not have, are unable to make the call from their room, from their living room, even over a phone. It becomes difficult sometimes. You need to engage with that patient and then ascertain that the symptoms, the problem isn't risky for them to be removed from the field of play. So, and that is the case in any sport or any clinical environment in which a doctor works. So I think there's been an evolution to requiring more and more doctors in sport because of the risks that people assume if doctors are not present. But if you are then making the commitment to having a doctor, you need to allow them to do their job, given their clinical expertise. And there's no way around that. Doctors are regulated by the GMC in this country, and that's the rules they have to follow in any working environment. And sport is no different.
Okay, so very specifically there, Eden Hazard calling you on twice for medical attention. That's the snippet, that's the part from that particular case that required you to act under law and under obligation to your professional body.
Exactly. And not only was I following my duty as a medical professional, I was following the rules of the game. And the rules of the game are there to be for a reason. So, like I say, there is nothing I can do in that moment but examine. Very different if a player calls and then changes his mind and says he no longer requires attention. That can happen because sometimes things hurt and symptoms decrease in severity. And there's been many times where we've run on field, we've been ready to run on and then there's been a change of mind, and that's perfectly fine. But I need to be released by that player because I have a duty to them. And
the referee is the marshal of the game in that sense?
Yes. And in fact, there are situations where the duty of the doctor supersedes that of the referee. For example, if the referee is on one side of the field because he's considering one part of the game and somebody collapses in what I think is a cardiac arrest or a serious head injury or starts stumbling because they're concussed, my duty to the patient in that case sort of would be to sort of bring attention to the referee that I need to go on. But most of the time, like if I don't manage to get that attention, I'd run on without his permission.
Okay, so some clarification around the specifics about what happened. Have you replayed that situation in your mind a few times since it happened?
I mean, I think it was very clear in my mind. It was extremely clear, and then obviously sort of it was corroborated by images everywhere. In terms of the medical governance of what happened was clear. There was no questions about it. And I think every professional body was clear about that too. Can I ask you, how did you cope during the situation that unfolded? I mean, I think I think I don't want to go into the negatives. Again, I don't want to go back to reliving experiences. What it's fair to say is that I think anyone who's been put in that position where suddenly, sort of there's all this worldwide attention and we're not, we don't live in ivory towers, where doctors are normal people. We don't ever expect to be on the front of every newspaper in every part of the world. Nothing ever prepares you for that. Suddenly I hadn't had any formal training for that. And And it's not something I ever saw happening because none of my male predecessors had ever had that sort of level of attention. So it was difficult. I think it's fair to say that now I've made peace with it. And even though it wasn't what I imagined, my little, again, 16-year-old girl, it wasn't what she wanted. I think I'm going to, like I say, I've made peace with that situation, and I'll do whatever is in my power to actually change the governance and the safeguarding of athletes in sports, which I think requires a culture change that hasn't yet happened.
And so when you say you've made peace, does that mean that you feel as though you've reconciled, you've parked it, you've moved on, or that you're now in a position that you can move forward with some sort of strength?
Yeah, I mean, I think the latter. I think, look, this is not something I chose, and it's very difficult for somebody who's worked so hard in their career and in what they wanted to follow, because it is many years of training, it is many years of following a particular career path, whether it's on hurdles and setbacks, to then have something like this happen and it completely out of your control. I didn't want to be in the public eye. I wasn't comfortable with it. I was a very private person. This has happened and here we are. So I need to make peace with it. And for a while, I think it's the best part of 4.5 years, I've been struggling with that. But now I'm going to accept it and do my best to change what needs to change. Because I think silence and not voicing concerns of a culture is very harmful.
And when you say silence in that sense, are you pointing to the conditions in other clubs, for your colleagues, other people in a supportive environment, perhaps where they need to speak up but perhaps don't have the strength or the facility or the voice to be able to do that?
Yeah, I mean, I think when you're working for an organisation, a club, a large, powerful corporate, as a doctor, you have a duty of confidentiality to the players, and it's fair to say that you have a loyalty to that environment as well, in terms of you try to work towards change from the inside. So I think it is difficult. I think there's a place for diplomacy, engaging in conversation about what structured change needs to look like. It's not about actually coming into war, making war with everything. But also I think it's important to recognise that silence in non-negotiable situations, be it child abuse, racism, so not safeguarding athletes in their requirements for medical care or medical decisions, then there's a duty to speak up, because you wouldn't get the Larry Nassars, you wouldn't get the situations that we've seen in sport, child abuse in football, if people went silent. So I think that there's a work for change from the inside, and I think there's a big responsibility, and it is really difficult to speak up. Obviously, it's much easier to align yourself with those that hold power. But I think we need to change this perception of, by not saying anything, I'm actually not doing any harm. I'm not doing any good, but I'm not doing any harm. Actually, you are the harm. If we've learned anything in the last few years, be it Me Too, be it the racism we're seeing, be it, like I say, medical governance, is that actually silence is extremely harmful, and it's what allowed very powerful and very evil individuals to continue doing what they were doing. Okay,
so what I'm hearing there is a couple of points about perhaps the passivity that can underlie relationships, dynamics, identifying issues where at its worst, ultimately, you don't want to rock the boat. If you're not active, that doesn't necessarily mean that you're not being, what's the word I'm looking for? Not complicit, but you're hiding it. You're adding to a culture of silence.
I would go further. I'd say you are complicit. I think if you turn your eyes to not seeing what is there to be seen, then you are part of the culture that's creating the damage to individuals. And I think historically, if we go back to all the cases of abuse, and this comes into, if you got a perpetrator of these situations and governance isn't observed, it allows those perpetrators to go unchecked. And this does spill over into medical decisions. With good medical governance, Larry Nassar could never have been so powerful for many years, because he was clearly not following governance procedures, and the systems were not in place in order to sort of to question what he was up to, really. So I think that's where I think we have to take on board that when we take this training, when we're part of this culture, we have a certain level of responsibility. And I'm not saying it's easy, but I think, I think we are in careers that are not for the faint-hearted either.
No, I think that's important to point out, that you're not speaking from a position of pandering and railing against everything unseemly in a football club. You're not campaigning here for a Puritan, sanitized environment. You're talking about not letting standards slip and saying and acting and changing when things are not right.
It's the best part of 7 years with one particular club. I had experiences of being within football cultures and research type scenarios. Prior to that, I think if I was upset by unsanitized environments, I wouldn't have survived very long in the dressing room. And I think there's a certain level amount of respect and certain boundaries that you have to very clearly define when you work in those environments. And that's, that is a responsibility that the individual holds. However, like I say, there are non-negotiables, and those should be clear. We've had enough examples of what happens when those non-negotiables are ignored.
How does a club, an organisation, set the right conditions so that people can speak and identify issues and don't feel afraid?
The first thing I think is having an understanding of what medical governance requires. It is about justice, and it is about auditing. It is about reviewing your systems and procedures. It's about having clear guidelines so that everyone knows their place. Everybody knows the boundaries of their duty and their expertise. In football, we live in a very little bubble. And sometimes we think that bubble is real life. And that's where the life, death, loss of limb, loss of life issues come into play. That's where governance is important. So I think representation of medical professionals, medically trained professionals in boards or closer to boards, the education that goes with that, educating those that are non-medically qualified as to why these systems are in place and why they cannot be overlooked, even when you're losing against teams that are much smaller than yourself, and it's going to look terrible on your results record. Understanding why those systems are in place, and this takes time. It cannot happen overnight. Well, I guess brings us back to the return to play and COVID, and it takes time to change a culture. But I think it's absolutely possible. And the important thing to say as well is that I think we have a new generation of players who are bright. We have a new generation of managers who are younger, and the culture, I think, will change. It'll be easier to do so in the future, but I think we need to put the systems and processes in place to allow that to happen. And it isn't about anybody feeling threatened that their practice is going to change. It's actually about understanding and enriching that allowing athletes to feel safe in processes and decision makings, and allowing athletes to know that they have a safe place to go with mental health concerns, and allowing them to speak up actually leads to better performance. I've witnessed that, where, athletes give their all or actually start feeling that they're not valuable despite their skill because decisions are overlooked.
And so what support does there need to be for people in a similar situation, whether it's a whistleblower, medical staff like yourself, or even the leaders in a position of responsibility for their business and the governance of their operations?
Well, in the end, if something goes terribly wrong, it should be understood that under health and safety organization legislation, a club chairman could be responsible for a death or an untoward development with the health of a player. So I think that should be a sobering enough fact. I think that's actually poorly understood. I think that the responsibility of all medical things that happen lie with the doctor. And equally, if something goes wrong, then the doctor will be liable and will start a legal process against that doctor. But actually, in order for a doctor to function, there needs to be a system in place to allow that to do. So I've been approached by a lot of legal firms wanting me to engage in medical legal work because this environment is so unique. And obviously I'm one of the ones that has had experience of it. And often when you examine these cases, is that the recurring theme is that, yes, the doctor didn't act following perhaps the best practice. But what comes out every time is that the system put him in a position to fail. And at the moment, the system is not being held accountable. But there will come a time when, for example, as we're seeing in the NFL with CTE, when we're seeing that actually the system is made accountable with dire consequences for everyone. So actually it's in everybody's interest, those that are so heavily invested in football, to actually change what was currently happening.
Are you pointing there specifically to, say, if the buck stops with the board, that we're then talking about having due process and diligence, such as a risk register, what actions were taken against that risk, the plans that were put in place, the weighing up of the decisions against the different facets of an organisation, so that ultimately, if a court case goes into a legal situation, there's an audit trail of the decisions made, and therefore how accountable they are to that decision or the outcome or the fatality.
Evidence of risk mitigation, not putting individuals at risk, be it the doctor and his medical decision making or the athlete in a particular situation. So this is all part of good governance, and football really has no excuse. It's well funded, and there should be the means to change this culture. And honestly, I think it leads to better results.
So specifically there, I'm just thinking away from this about how ultimately, if you've got a positive culture that's embracing voices, it has got diversity of inputs, that the most highly paid person isn't the most powerful at the club or the organisation. You're unearthing opportunities there for you to be able to improve performance on the pitch.
Honestly, at the times that we've had success, there's been an atmosphere of respect, of valuing the individual, of valuing the human in that process. And really, that's, I think, when we all give our best. It's certainly been well studied in the corporate environment in terms of leadership styles and how people feel valued and encouraged and perform better. And it's absolutely, even though we intellectualize it a lot less, it's absolutely the case in football. We knew our athletes very well. And I can tell you of times when people were lost in their engagement, losing the dressing room. It was clear in their faces and the expressions. There are many times when I remember those faces and expressions. They stay with me very clearly as to a lot of respect for, sort of leadership situations, be it at club or managerial level. And I think there are good parallels to be held by it's like in the army, for example, where every ship has to have its captain, and that's a certain form of leadership. But actually, you have medical staff within that have their role. Everybody knows the system because there is a governance procedure to that system, and that machine then works like a well-oiled, efficient machine that produces good results. And that's when lives are at risk, and it's war. Why cannot we reproduce those systems on a football pitch or in the build-up to a big result? But it requires confidence, and it requires people to feel secure, and it requires a bit of a longer-term planning and thinking. And this old style of leadership of perhaps more dictatorial, sort of bullying, harassment. The new generations are not going to tolerate bullying and harassment. They're well versed in what they are not going to tolerate. So I think the old leadership styles perhaps would not be quite so successful in modern football.
And what would you like to see, say, 5 years down the line? What good should come from not only your case and your experience, but also what you've come to strengthen, the points and the ideas that you have got renewed strength around?
Well, I think it's very, very much that. Perhaps we're sort of touching on it again, but I think the safeguarding of athletes in their medical treatment, I think that is very close to my heart, and I passionately believe that any individual should be given the respect and the place in their that they can be autonomous as to the decisions they make, and their place of work, regardless of how much you're paid, regardless of how glamorous the environment, regardless of how much media attention that place of work has, that individual should have the respect and should feel safeguarded in issues of race, in issues of, like I said, medical decisions, gender, sexuality, religion. And I think that's very much left to the autonomy of each particular culture and each club. But I think there should be a corporate governance embracing of the fact that medical governance is part of this well-oiled machine that actually then becomes more robust to resist litigation.
And can I ask you about where you are at now on this day as we're talking? How are you emotionally, professionally, personally, philosophically?
Well, I'm very well, Steve. I'm pleased to say I think one of my objectives, having been through difficult situations, every difficult situation I've been in my life has always been like, how am I going to feel? And I asked myself this during the processes and the situations that we lived. I asked myself this every day. How do you feel about the decisions that you're having to make today? How will you feel tomorrow? How will you feel in a week? How will you feel in a year? How will you feel in 5 years? And how will you feel in 10 years? And I think that's important. And what prevailed every single time was I need to be able to live with myself and going through this. And this was this really informed the decisions I had to make and through the entire discomfort of what was happening to me, to my family, to my husband. I was just about to get married and we got married the first year of my marriage. It should have been a really happy time. I was about to be the next director. So it's I think that's important. And I think if anybody can take something from this is that think about the future. Sometimes you can ease the discomfort for the moment, but then that leaves you feeling really restless. That has allowed me to move on, to be happy, to enjoy perhaps some of the things, the autonomy, some of the things, the work-life balance, although I'm still not terribly good at that, that I couldn't enjoy, because when you are part of that system, literally there are no days off. Night and day, your phone's on, and I can now switch off my phone and go horse riding, for example, or, sort of go, that to me was a real novelty that I'm very much enjoying. I have a quality of life. I feel passionate about the same issues. I'm going to keep passionately discussing the issues that need to be aired, really. And I think there is a price to pay for that. I think when you speak up, there's a group of individuals or there's a culture that perhaps treat you as if you're doing something wrong, and that can be a very lonely place sometimes. But I think it is important to air that, because I didn't do anything wrong. I was only doing my job. And that's why I feel confident about continuing to speak about it.
It's powerful stuff, and I'm overwhelmed by how you've conducted yourself. And I can only imagine it would have been fairly easy just to have crawled away and just stepped away and just thought, you know what, I can't handle this. And I can imagine that would have crossed your mind at different times. But the fact that you've got this renewed strength, that you are adding to the cause, is profoundly powerful to hear it. And instructional in many ways, that listening to you and thinking about how can I find a better way of doing it myself. So thank you so much for joining us, Eva, and sharing your insights, your lessons. And it's perhaps too glib. Often we say fighting the good fight, but you're definitely fighting a good fight.
Well, thanks very much. Well, hopefully there'll be, like I say, there's new generations of both managers and players, and I think they are key to changing all of this. But also I think it's important to say that actually the fans also have a responsibility, because what I think makes the culture so robust to continue on change is that fans, because our parents, have supported the same teams, because it becomes a generational thing that we sort of tend to overlook what isn't so good. But I think it's, we're in a time now that actually it's about actually wanting to support the right things, the things that are, I believe, going to change the world. And I honestly do believe fiercely that the next generation is going to be able to do that.
Well, I'm just wondering, that's an amazingly optimistic view, and I think we should all share in it. Maybe that comes from your father, who was a Real Madrid fan, but recognised excellence in a Barcelona team. That takes an awful lot of open-mindedness.
It does, with occasional retributions, but absolutely does.
Eva, thank you so much.
Thank you, Will. It's been a pleasure chatting to you today. Steve, many thanks for being so respectful and so sensitive and patient in waiting for me to be able to be ready to speak.